Hey, I'm Dr. Blaylock, owner and founder at Lakeside Dental. What's driven my approach to what we call restorative dentistry? Restorative dentistry just means restoring teeth or fixing teeth. It's the most rewarding thing that I do, being able to save teeth. And really, over the last 10 years, I've spent over 500 hours of continuing education just learning how to save your teeth. When someone has a damaged tooth, how do I decide what type of treatment is going to be best for them? The first thing that we got to get is a diagnosis. So, what caused the tooth to break? Was it because we bit on a Jolly Rancher, or because there was a cavity in the tooth, or because there was a crack in the tooth? Sometimes small cracks or small cavities can be fixed with a filling, where we take a really small part of the bad part of the tooth out and then put a filling, a biocompatible filling material that's white inside that to give it strength again, to make it look like it used to. Sometimes, if there's a crack in the tooth or if the cavity got to be pretty advanced, we go in and put something called a crown over the entire tooth to replace what the good enamel used to be able to do for the tooth, to provide it with good, strong support. Some signs that I often hear patients report that could be indicators of the need for restorative care. The first one, obviously, is a different texture or feeling on your tooth. Sometimes when we chip a tooth or break a tooth, it feels different to our tongue. So if something feels different, definitely come into the dentist and get it checked out to make sure we don't need to go in and provide restorative treatment. Another sign that we see could be indicating the need for restorative dentistry is discoloration. If the tooth goes from a very white appearance and then it gets to more of a yellow color, or if the tooth appears to look longer or shorter, these are indicators sometimes overlooked that may mean we should probably intervene with some type of restorative care because something's going on. And then lastly is obviously pain or discomfort. The scary part is by the time we feel sensitivity in our tooth, whether it's pain or pressure, sometimes hot or cold sensitivity, it could be too late, and the tooth could require some more involved or advanced therapies. Do we use technologies to make restorative treatments more efficient or more comfortable for our patients? Absolutely. I'm a big believer in utilizing the latest and greatest techniques and technologies out there. When we make anything out of porcelain, whether it's a crown or an onlay or an inlay, sometimes even a veneer, we can make those directly in our office with some really advanced technology. I also have a 3D printer that can provide very quick, sometimes temporary solutions to patients who might be in a bit of a hurry or a rush to get to the final product. What's my favorite personal restorative procedure that I absolutely love? I love providing very quality crowns to our patients. It's really satisfying when I can take a tooth that's black and discolored and breaking down, and you would look at it and think like that tooth is on its way out. And then an hour and a half later, we make that tooth look like it was 16 years old again. Makes me so happy. What would I say to someone who's maybe putting off repairing or fixing a broken tooth? The first thing I would do is just ask, is there something we can do to make this more convenient or possible for you? Is it anxiety? Is it financial arrangements? Is it time? We want to do everything that we can to help accommodate our patients and provide options and solutions to help maintain and save your teeth. The longer that you wait, unfortunately, the higher likelihood of tooth failure. The sooner we can fix a broken or fractured or damaged tooth, the higher chance we have of saving that tooth. If someone knows that they need restorative care or they have questions about possible restorative care, there are two ways to reach out to our office. Number one is just send us a text message. We have real humans that will respond to you, not just a computer. And then, secondly, you can just pick up the phone and give us an old fashioned phone call. We have people in our office who are more than happy to talk with you and get you scheduled for a consultation with me to discuss any of your restorative needs.